Thank you so much, Governor, for that kind introduction. And thanks to all of you for being here and for joining us for our 5th Annual Solutions Summit. It's an honor to host so much talent from throughout Utah and throughout the entire country at this event. This is an event that we've dedicated to the opioid crisis. And, you know, there are few issues that are more pressing today or more devastating than this very crisis. And I can think of no better place to discuss this crisis than right here in Utah, where so many people are so passionate and so willing to work together to address this and other problems. It's why we've convened this summit, to hear from some of the best and the brightest warriors in this life and death fight, because it really is that. Before we get into today's panels, I'd like to preface our discussion with some facts and figures about the opioid crisis in America, and some thoughts on how we got here, what it really means, and on how we can beat this epidemic. Congress's Joint Economic Committee has put together a fascinating report that outlines the numbers behind the opioid crisis throughout the country. Let's start with a map showing all counties across the United States. You'll see that 40 years ago, when we first started keeping track of this data, only a small handful of counties had opioid-related deaths, counties that were relatively isolated. And they also happened to be the same counties with historically high drug abuse rates and also historically high death rates to begin with. But then, over the last 40 years, and over several phases, in several spurts, we've seen the rate of opioid overdoses exploding. No state has been spared. This plague has spread everywhere. It's reached the proportions of a true epidemic. This is no longer isolated to a few communities where historically there was a lot of drug abuse. This has permeated every corner of our great nation. And in fact, between 1999 and 2016, the rate of opioid-related overdose deaths quadrupled in America. The total number of deaths during that time period from that cause was 632,000. It's a staggering body count of Americans, higher than that claimed by the Civil War. In 2017 alone, nearly 48,000 Americans died from opioid-related overdoses, a far higher death rate than we have experienced from HIV, from guns, or from car accidents. This American carnage has struck Utah as well. About 6 Utahns die per week, every single week, from opioid or heroin overdoses. And 3 rural Utah counties were identified recently by the U.S. Department of Agriculture as being among the most vulnerable counties nationwide. Families and communities in Utah and across the nation have been robbed of loved ones by these premature and, I would add, unnecessary deaths. In addition to being robbed of these premature deaths, there are also people who have been robbed of days, weeks, months, years, and in some cases decades without really being able to live, or seeing a family member still breathing and walking, but barely so. So the stakes are high. They couldn't be higher. It's going to take our strongest efforts to combat this crisis, or perhaps more accurately, to combat these crises. Because when we look at the facts, we see that there's not just one single opioid crisis. It's a lot more complicated than that. There are actually a whole lot of opioid crises coming together at once. There's a rural crisis, and there's an urban one. There's a crisis hitting poorly educated Americans, and there's one hitting the highly educated. There's one that's hitting adults, and another one that's hitting kids. And all of these crises take different forms in different parts of the country. In some states, the overdoses are caused more by prescription drugs, the kind of thing that you'll see in a bottle with a neatly printed label from an authorized pharmacy having been prescribed by a board-certified medical practitioner. In other states, more of the deaths are caused by illegal narcotics. In many cases, deaths are caused by a combination of drugs. For example, data on opioid overdoses in 2016 shows that while states like Illinois and Wisconsin had primarily heroin-related deaths. States like Utah and Oklahoma had deaths primarily involving prescription opioids. And as we can see in this chart, prescription opioids have consistently been the biggest problem for our state. But it's also notable that in the last few years, perhaps the deadliest drivers of the crisis nationally have been fentanyl and heroin, the most common opioids sold on the streets. From 2015 to 2016, just in that interval, the number of deaths from these drugs more than doubled. And in 2016 alone, fentanyl and heroin were present in more than 2/3 of all opioid-related deaths. At 50 times the strength of heroin, fentanyl is particularly lethal. And it's so lethal, in fact, that it makes a lot of things more complicated. Mere skin contact with fentanyl can itself be fatal. Fentanyl also poses a special danger because it's incredibly compact, incredibly potent, and it's therefore easy to conceal, and it creates special problems when traffickers try to cut it or dilute it. So, trafficked from China, it's most often shipped rather than smuggled across our borders through the mail. So in the face of such a complex, multifaceted, and growing crisis, or series of crises, we might say, there's no chance that there's going to be just one solution. One-size-fits-all policies simply will not work with this set of crises. We're going to need many solutions, and they'll require all sorts of efforts from a wide breadth of people, each adapting to one part of the country or another, one age group or demographic or another. They will require the collaboration of hardworking, innovative individuals in the medical field, in law enforcement, in government, and our local communities. They'll require prevention on the front end, as well as responses to treat those already suffering from addiction on the back end. And we'll need to tailor our solutions at the state and local levels, where we can best address the numerous causes of these crises and best reach our children, our parents, our neighbors, and our friends caught in the grip of addiction. We've so far focused on the supply of these drugs, but it's every bit as critical also to look at the demand for them. In fact, we know from experience that if you focus only on the supply and not on the demand, you're going to end up having a problem. So we have to ask questions like, who exactly is overdosing on these drugs, and why are they turning to them in the first place? The Social Capital Project, spearheaded by Congress's Joint Economic Committee, has discovered that there is a really strong, unmistakable, in fact, social component to this crisis. Our work has found that those who are most vulnerable to opioid addiction are often lonely, and they're cut off from sources of personal connection and fulfillment, like meaningful family interaction and meaningful work. Individuals who are divorced or who never marry make up only about 32% of the population in the United States. But while making up only 32% of the population at large, they account for an astonishing, overwhelming 71% of all opioid deaths. Similarly, individuals who have no more than a high school education are themselves disproportionately more likely to die of an opioid overdose. Single men with only a high school education have an opioid death rate almost 3 times that associated with single women at the same level of education. Research also shows that those who succumb to opioid addiction usually have other issues that come along with them, other mental health issues, issues like depression or anxiety, or they've had prior struggles with drug or alcohol addiction. We cannot ignore the fact that there is a profound human element to this crisis. The absence of both purpose and community has led to these tragic deaths of despair, as they've been so aptly named. And that's precisely why the bulk of our battles must take place, must start and ultimately finish within our communities, person to person, face to face, eye to eye. Now, this is not to say that there is no role for the federal government in fighting the opioid crisis. Quite to the contrary. The Drug Enforcement Administration has already played an important part here in Utah and elsewhere in the country, but I'll mention particularly here in Utah by working with the Attorney General's office to prosecute drug cartels and to sponsor take-back days during which Utahns can return unused prescription drugs that might otherwise be abused if they're left to sit around in medicine cabinets or elsewhere. And Congress should take steps, additional steps, like strengthening Customs and Border Protection's authority to discover and destroy packages with illicit drugs, establishing a system to stop suspicious orders of opioids from drug manufacturers, and requiring the Food and Drug Administration to update the way it assesses the safety and efficacy of new drugs. But just a national federal bureaucratic response will not be enough. Not now, not ever. Too often, federal grant programs have little accountability. And too often, they're inflexible and unable to meet the unique needs of specific states and individual communities and neighborhoods. So much of the real work involved in solving this crisis will necessarily, certainly unavoidably, be at the local level. If we're going to work to stop the spread of opioids, then we need to build more resilient families and stronger neighborhoods and communities. These battles will be won in the offices of governors, but also of sheriffs, doctors, in hospitals and rehab clinics, in churches, classrooms, and especially in living rooms and in dinner table conversations across Utah and throughout the nation. The struggle against addiction and isolation cannot be won exclusively at the federal level. We can create social capital only at the human level, not simply as fellow taxpayers or citizens, but as fellow human beings. And on this front, I do believe there is reason for hope. There's reason for optimism. Utah's efforts and the results that we've been seeing are proof of this. While opioid overdose death rates rose 10% nationwide last year, Utah was one of only 14 states where they fell by almost 20% in Utah. And this was the third year in a row that Utah in particular saw a decline. For many years, entities like the Utah Coalition for Opioid Overdose Prevention and the Utah Department of Health have worked diligently to combat the crisis. And since last year, Utah Attorney General Sean Reyes and DEA Special Agent in Charge Brian Besser have complemented their work by forming the Utah Opioid Task Force. This task force has assembled experts from across various fields in medicine, law, treatment, recovery, law enforcement, and business, all united in an effort to save the lives of Utahns. They've prompted awareness of the perils of opioid dependency. They've worked with physicians to change prescribing patterns and practices. They've sponsored take-back days, and they've successfully prosecuted drug cartels. Groups like the Utah Support Advocates for Recovery Awareness, or USARA, have also done tremendous work. Mary Jo McMillan founded USARA to open Utah's first addiction recovery community and advocacy organization, and opened Utah's first peer-run recovery community center in 2011. Jennifer Plum's efforts in co-founding Utah Naloxone have yielded tremendous results. This nonprofit organization has already saved thousands of lives by distributing kits to administer naloxone, a powerful medication that can in many cases be life-saving by reversing the effects of opioid drugs. And One Voice Recovery, under the leadership of Patrick Rizak, works to remove the stigma surrounding addiction and to empower individuals going through recovery. You see, it's this stigma that too often in our society, in our culture, has led to more isolation and facilitated more abuse until in some cases it's been too late. If we remove the stigma, we can talk more about it. People will suffer less isolation. Ultimately, we'll see abuse rates drop, and with them, overdose death rates drop as well. These Utahns have all been stepping up to the plate. These groups and so many others have made such a difference on the ground and in our communities, and I believe there's so much we can learn from them today. The founder of Overdose Awareness Utah, Amber Baum, tragically lost her 22-year-old daughter, Kenzie, to an opioid overdose several years ago. Prompted by her own work to address this tragedy and to confront it in her own life, and reflecting on her work to address the crisis that is faced by so many others, she offers these insightful words, quote, "Overdose deaths are treatable and preventable. The solution is not one size fits all, but together we can figure out how to rescue and heal. Remember, too, continuing to love those who are fighting addiction, while not easy, is the best way to help them connect with support and resources. Connected communities allow recovery to happen and become the answer," close quote. Well said. It's my hope that today's event will lead us to more deeply connected community efforts to fight and ultimately beat this modern-day plague. We can beat this. Together we can, we must, and we will. Thank you very much.